Everyone, I'm Brittany Hetzel, and I just finished my clinical capstone at Gundersen Health System in La Crosse, Wisconsin. I was lucky enough to be a part of the critical care team for this past semester. I really enjoyed it. From the start of my nursing school career, I have always wanted to be a part of critical care or the emergency department, so I was super lucky and excited that I was able to be a part of third floor at Gundersen. So my transition from clinical synthesis, started my initial impressions of what it's like to be a critical care nurse as someone who is scared and nervous and just not feeling ready. But after doing a couple overnights, a couple 12s with my preceptor, I was super comfortable, and she made me feel like I knew what I was doing, and it's okay to be nervous. After all, she's been there for like 3 years, and I've been there maybe 24 hours. So I used my skills and I jumped in where I could, and I did whatever I could. Any opportunity, I just immersed myself in it, and I think that really helped because it just made me feel like I actually was a nurse. And some of the other nurses asked me, they're like, have you like worked as a critical care tech before? Have you worked like as a nurse like intern somewhere? And I haven't. I've just been a phlebotomist at Gundersen for 3 years and prior CNA experience, but I I think if you immerse yourself into any situation and just use your knowledge, what you've been given and learned all these past 4 years at Viterbo, then I think that you really have a good shot of, being a nurse in any situation. I also used my professional values and evidence-based practice as a professional nurse in my capstone experience. When we did our project, I chose to do early mobilization of an ICU adult patient because my first patient on my first night had a traumatic brain injury, and we actually were in charge of getting him up into a stand and into the chair while he was intubated and sedated because our protocol includes early mobilization. So I used my nursing values and judgment to, realize is that really like ethical to get someone who's intubated and sedated out of the chair, and be a good advocate for him and make sure that we are being safe and find out the best research about that topic. So it's pretty interesting to like put everything together that I've learned throughout my courses at Viterbo to create a final product that I got to present to faculty members and my preceptors and professors and future nursing students. So I thought that was super cool. Goals for this capstone experience, I really wanted to do CPR. Like, we have always like done our BLS recertifications and our CPR classes, but you never actually get to do CPR. And as a critical care nurse, I think that advanced cardiac life support is super important, and you deal with that almost every shift at Gundersen from when I've been there. So not even 2 hours into my first clinical, we had a patient who was a full code who deteriorated, and they coded, and my preceptor like pushed me out of the way, and she said, go in that room and do CPR. I'm like, what if my compressions aren't good enough? What if I mess up? What if I'm not doing something right? And she's like, you will be fine, I promise. And I jumped in. I was first in line to do compressions, and it is much different than what you learn in sim. It is definitely not like one of those mannequins. And it was, this sounds bad, but it was such a cool experience. It obviously wasn't cool that the patient was coding, but it was so invigorating to do compressions on someone to try to get their heartbeat back. And we ended up getting them back, and it was really cool. I really liked it. And me and my preceptor talked about what happened after and what medications were given and how my compressions could have been different. And just everyone like on that patient's care team like was so supportive and like just really acknowledged that I wanted to learn and be better and just get myself involved. So I thought that was awesome. So I definitely attained my goals for this capstone. Barriers that would get in the way of this would be probably not having patients who required CPR, or having all patients who had DNR or DNIs. But thankfully, I got a lot of experience of CPR at this Capstone experience. I think that the biggest emotions that I experienced throughout this Capstone experience was, what if, or am I not good enough, or am I not gonna get this? And now at the end, like, I was setting up like 9, 9, 10, 11, 12 different meds on an IV pool. Like, I took care of some really sick patients, and I had patients who had ICP monitors, and who had like brain flaps, and I did CPR. Like, what nurse gets to do that on their Capstone experience? I saw the sickest of the sick. I experienced death, life. I had an organ donation patient. Like, I am so proud of myself and lucky and just very grateful that I had this experience at critical care, and I can't imagine what my experiences would be if I were somewhere else. So I'm very, very grateful. In the future, I will definitely take my experiences that I had from my Capstone experience, not only on the floor, but off the floor as well, learning and how to do research, present research, how to um, you know, critically judge articles and evidence-based practice, and to pull all of those resources together for a final product to present to others. And I will also take my ability to jump into new experiences and always be excited about learning. And I just always want to be someone who jumps into something new and loves every second of it. I am very thankful and proud of the experiences that I have been offered through my Capstone experiences, and I'm so excited for my future ahead. Thank you.